I'm Dr. Kevin Kaplan from the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. I'm here at the JCA, Jewish Community Alliance, giving a talk about shoulder injuries, shoulder symptoms, and how we treat them. The goal of the talk is to define the basic anatomy of the shoulder, bring it down to a level that patients can understand, and go over the different signs and symptoms of shoulder pain, the different diagnoses that I see in my office, and how I treat them. And the other thing I look at is to see if the rotator cuff tendon has been torn for a long period of time, because that's also very important. The way that we can determine that is by looking for what's called muscle atrophy. As I told you before, any muscle and tendon unit starts from point A and attaches to point B. And if you liken it to like a rubber band. So if you had a rubber band attached from point A to point B and you cut the rubber band, what would happen? It would spring back a little bit. And if I took that rubber band and I laid it out in the parking lot for 3 weeks, and then I brought it back inside to you guys and tried to pull on it, what would happen? It breaks. It's brittle. You can't stretch it anymore. So very similarly, a rotator cuff that tears, all it knows how to do is go back and back and back. And over time, if we didn't exercise, what would our muscles turn to? Atrophy. Turn to atrophy and turn to fat. And so what I can look for on an MRI is to see if there's what's called fatty atrophy. And that gives me an idea of how long this rotator cuff has been torn. So here is a good example. These are rotator cuff muscles here and here. This is the supraspinatus here, but you can see all this white stuff around it. Right? That's fat. Right? So that muscle, instead of looking like a big healthy muscle, that muscle, a lot of it is a turn to fat. And that's important for me to be able to determine whether or not, if I go in there, will I be able to stretch that tendon over? Will I be able to fix the rotator cuff? We used to not have many options if a rotator cuff was torn and retracted for a long period of time, but there's a newer procedure I'm going to show you that have been doing for about a year and a half now, and I was one of the first people in Florida to do it. That's been a very successful option for patients that have a massively retracted tear that you can't fix. So again, arthroscopic treatment is the way we fix rotator cuff tears when they heal. When they are torn. And we make small incisions, put a camera in, and we're able to use our shaving devices and all our instruments to basically repair the tendon down to the bone. But do rotator cuff, as I said, not all rotator cuffs need surgery. It depends on the symptoms. All right? If non-operative management is always a mainstay. It's always the first thing. You don't lose anything by trying that. All right? That includes physical therapy, anti-inflammatory medications, cortisone injections like we talked about to decrease the inflammation, lifestyle modifications. You know, some patients say, look, I can do everything I need to do. It hurts me a little bit, but I can function pretty well. Those patients may not need a rotator cuff repair surgery. But as we know, pain is cyclic. Right? So pain may come, pain may go. As the tear gets bigger, it may worsen with time. And it's a very common way to practice to say, okay, we'll treat your symptoms when you have them, but if you're able to do everything, you don't necessarily have to have surgery. But the fear is that a full thickness tear can progress, get bigger, and retract like we talked about. And when it retracts, it may become irreparable, and that's a big issue to me in terms of telling you if I can make you better. So you have symptoms of shoulder pain and you need more information, come visit us online, joi.net. You can see me at my website, www.kevinkaplanmd.com, to learn more about the shoulder. If you have symptoms that don't go away, pain at night, pain when you lift your arm over your head, clicking, popping, come and see us at JOI. We'll be happy to help.